in one of the medical journals just last year, 2017, was from a group of cardiologists, and it was very interesting. They said that, and they're talking to physicians and saying, if you have patients that you're prescribing blood pressure medication for, and their blood pressures are not actually getting normalized based on your regimen of medication, you need to look at the patient and see if they're using an antimicrobial mouthwash, because that mouthwash is if they're using it, it's increasing their blood pressure because of the damage to the nitric oxide. Now, that's a pretty interesting study and a statement that this group of cardiologists made. So people are slowly getting aware of it, but the far majority of the medical profession and dental profession still think that you need to use antimicrobial mouthwashes every day, and you need to scrub the tooth so that it is literally stripped completely of the dental plaque. And then they want you to use chemicals that prevent the dental plaque from forming naturally and normally.
That makes so much sense to me. And you have obviously the research side. I've always had an instinctive sense of this. Like, for instance, my in-laws, when I married into their family, I noticed they all brush their teeth very hard, and they're like, they have some German blood. So they're definitely like very routine and consistent. I have to give it to them on that, but they all brush so hard. And as they've gotten older, some of them have receding gums and all kinds of problems. And it just never seemed right to me to brush that hard and that harshly. And I couldn't ever pinpoint why. But as you're saying this, all this kind of just comes together and the puzzle pieces start to make sense. And I'm really curious too, like, so essentially from what you're saying, we have an oral microbiome. I think most people are familiar with the gut microbiome. That's been widely talked about in recent years. But from what you're saying, like, our mouth has a microbiome as well, and that balance is equally important to our health. Is that right? And does it interact with our gut and our skin microbiomes as well?
You're absolutely correct. And actually, what I believe and the research suggests is that the microbiome in the gut absolutely directly affects the microbiome in the mouth. And if you think about it, of course, the mouth is the beginning of this tract from the tip of your lips to the other end. So all this mucosa from your mouth all the way to the other end has a interrelationship, and the bacteria literally talk to one another. And the bacteria throughout the body talk to one another. I have heard some fascinating studies that mention that the bacteria actually talk in two major ways. One, they create chemicals that they can release that other bacteria and other immune system cells of our body can sense to know who's who in their environment. But they also create a frequency, an electrical frequency that kind of sings to these other bacteria as well as the immune system. And when that frequency is not the frequency that other cells recognize as normal and healthy, that's one of the triggers where the immune system can attack a bacteria that is not healthy because its frequency is not the normal frequency of the bacteria for the mouth. It's pretty fascinating stuff. But dental plaque has several biological functions. Dental plaque is made up of maybe up to 700 different types of bacteria. There are a lot of people have different numbers, but whatever it is, it's quite a large number of various types of bacteria. And they're all in this state of homeostasis, meaning they're in balance. They do good for one another. So they actually produce in total some degree of hydrogen peroxide. And this peroxide that the normal dental biofilm called dental plaque is producing literally kills other potential pathogenic bacteria that might want to try to invade the area. The dental plaque also creates an acid level that is basically neutral, so it doesn't allow for demineralization or damage or decay of the root surface. And the other thing that it does is it's kind of the conduit for mineralization of the root if necessary. So the saliva produces is the transport system for all these minerals that are necessary in the mouth. And the minerals kind of get absorbed into the dental plaque. And the dental plaque in its gateway tending properties allows these minerals to go to the surface of the root as necessary to mineralize the tooth 24/7. So, if you had early decay for a variety of reasons, but you had a healthy diet and you had minerals in your saliva, your body knows how to remineralize or eliminate the early stages of decay, which I know you know that. So dental plaque has three primary reasons, and if you remove that, it's like taking all your clothes off and walking outside. You're totally exposed. I mean, the root surface of the tooth and the gum margin is supposed to be protected by this natural, healthy biofilm. It's one of the healthy biofilms in the body until it gets unhealthy.
Right. Like everything in life, so much is about that balance. I'm glad you mentioned remineralization as well, because of all the things that I've written about, probably with the exception of why I don't bring down fevers in my kids, that is one of the more controversial things I've ever posted about, the ability of teeth to remineralize. And I've had this experience personally where after researching this and getting into more natural lifestyle and switching my diet really drastically, I had cavities that were very small. They weren't like drastic cavities, but I had them arrest and then start to remineralize. And people are adamant, even dental hygienists that comment are absolutely adamant that this process cannot happen in the body and that teeth are not capable of remineralizing. So I'd love it if you could go a little deeper and explain, like, I mean, you kind of covered it pretty well, but explain like what that process is and how we can support it. Because from what I researched, it's the role of saliva, like you said, having the minerals there for the tooth, but also the internal and what we eat is so drastically important. But I'd love if you could expound on that.
Sure. So one of the things that you need, or your listeners need to be aware of, and anybody needs to be aware of, is that the enamel on the surface of the tooth, that's the white color of the tooth when you smile, that hard enamel surface does not grow new enamel. So you're not going to grow new enamel if you have decay. But if you did have some decay in that enamel surface or the root surface, there are minerals, calcium and phosphorus and a variety of other minerals that are associated in the saliva that can actually rebuild, redeposit, and strengthen the surface where it's been demineralized. The reason that a surface becomes demineralized is because the acid level drops below a pH of 5.5. And like I said, the biologically healthy dental plaque helps to maintain that pH in a more neutral acid environment rather than a very acid environment of 5.5. Now, if you're eating foods that are unhealthy, like sugars, for example, and grains, for example, and I'll give you some reasons why. So the sugars are going to feed the pathogenic bacteria. So you have this bacteria in the mouth that is basically normal, but individuals could become pathogenic if they were to be overgrown. So if you're eating the foods that encourage the bad bacteria to overgrow, like sugars, then these sugars, as they ferment the bacteria that ferments the sugar creates a tremendous amount of acid, well below 5.5, meaning it gets very, very acidic. And that acid literally melts away the minerals on the surface of the tooth. As the minerals dissolve away, then this bacteria can start to penetrate the surface, and now it becomes a snowball effect. So in the beginning, if you have minerals that are healthy and the acid level is more neutral, these minerals can be dedicated to get rid of this softer tooth structure, which is the decay. And the natural dental plaque, actually, because of the peroxide in it, can maybe kill off some of the bad bacteria and overwhelm them with the healthier bacteria, and you get remineralization.
Got it. Okay, so that makes perfect sense. And I feel like it really also explains in better detail why, like a really compelling case for avoiding sugar. Because, I mean, I know most dentists are on board with that sugar is not good for the teeth. But until I started researching and getting into the natural side, I had only heard it mainly from the perspective of sugar is bad because if it sits on the teeth, it can lead to tooth decay. But from the way you're explaining it, it also can affect, like, obviously gut bacteria and that balance in the mouth. And it can create the problem in so many more ways than just that it sat on your teeth. And I feel like that is maybe a key and I'd love to hear you speak to this, what your opinion is, but I get emails from moms who are exclusively breastfeeding their babies, for instance, and the baby will have, like a 2-year-old will have tooth decay, and the dentist will tell them you need to stop nursing your child because the breast milk is what's causing tooth decay, or like, nursing at night or any of that is bad for the baby's teeth. And I'm really curious if you have any input or insight on that, because from what you're saying with the sugar and the bacterial balance, I would think something like breast milk, for instance, would actually be supportive of the bacterial balance in the mouth and not problematic. But I wonder if you've researched this at all.
Breastfeeding is critical. Breast milk has loads of friendly bacteria, and it's critical not just for the mouth, it's critical for the baby to develop its immune system. So the baby during birth develops an immune system from the mom. And after birth, and the baby is nursing, it improves its immune system from the bacteria in the breast milk, which is normal and healthy. In the breast milk, there's also many what's called polysaccharides, which actually are fibers that feed the good bacteria in the gut. Breast milk is critical, but breastfeeding is even more critical for the development of the jaw. Do you want me to get into that at all, or no?
Yeah, absolutely. I'd love to hear your explanation.
So there are so many people that have malformed jaws today. And a lot of it goes back to the nutrients that mom ate and the children, and as they grow up to be adults, are eating. But a lot of the development of the jaw also is related to breastfeeding or improper breastfeeding. So when a child breastfeeds, the nipple is placed in the mouth and it pushes onto the soft palate or the hard palate, which is the bone around the upper teeth. And the pressure of the sucking, as well as the pressure of the nipple and the breast on the hard palate, helps the hard palate to slowly expand naturally as it grows. And as children breastfeed, the breast conforms to the growth of, or the growing potential of the hard palate. And it makes way for the room for the natural teeth to erupt completely. And then the lower jaw accommodates to the size of the upper jaw so it grows properly. When parents, moms, don't breastfeed or only breastfeed for a short period of time, the baby does not have the natural stimulation to grow the upper jawbone correctly. And that's why there is frequently crowding of the teeth. If you were to buy these different orthodontically designed nipples for feeding, bottle feeding, at any point in time, maybe that orthodontically designed nipple will fit the palate of the baby correctly, but the plastic of the nipple isn't growing as the baby's growing. So it'll only accommodate for a short period of time, and then all of a sudden the pressure is not there, or it's not expanding like the jaw is going to expand. So breastfeeding is very critical, not only for the nutrients, not only for the bacteria, but also for the development of the proper shape of the jaw. There are some primal societies that breastfeed for their children between 2 to 4 years old.
Yeah, I'm so glad you brought that up, because I'm sure you're familiar with the work of Dr. Weston A. Price, which was one of the first resources I found on this in his book, Nutrition and Physical Degeneration. And it really struck me the jaw structure. The teeth were beautiful, but the jaw structure of some of these native populations, they have these amazing wide jaws and like beautiful face structure because of that. And at least from what I've read, that's something else that we're seeing a lot in modern society, is that children especially are being born with much more narrow dental arches and I think like a more narrow maxilla, which is that top bone, as well as like that. And because of that, like they have a more narrow airway from what I've read, as far as like, because that bone is critical to the nasal space and the throat space and how much air a child can get. So like from what you're talking about, this is not just critical even for just oral health. This is critical for lifelong development. And I'm so glad that you touched on that and brought that up. I know one thing that we've done with our kids, in the hopes of avoiding braces. My husband and I both had braces, and all of our kids are on track, it looks like, to not need them. But I did breastfeed them until they were almost 2 and exclusively until they were about 8 months. And they had that start in life and also the nutrient dense diet. But also we've been using these mouth guards with them that do that. They kind of apply that gentle pressure at night, just to kind of help keep training the top of the mouth, the palate. Are you familiar with those, or what is your take on those? I wasn't even planning to ask you that, but I'm glad we brought it up.
That